Hi, I'm Bisma, and you're listening to The Other C Word, a podcast about all things cancer from a stage 4 breast cancer warrior. We cover health and wellness, mind, body, and soul. Plan to leave each episode with hopefully some new insights and inspiration. Let's get into this week's episode. Hi, everyone. Welcome back to the podcast. I'm really glad that you're tuning in today because we're diving into a topic that's super important for anyone navigating a cancer journey, which is how to communicate and advocate for yourself during treatment. Okay, so let's be real. Navigating the healthcare system can feel like such an uphill battle, especially when you're facing a cancer diagnosis. There's a lot of medical jargon flying around, and it can feel really overwhelming. And you're probably not feeling well and confused how to navigate all of this while you're physically not well. But it's so important to feel empowered and to speak up for yourself, ask questions, and make sure that your voice is heard during this whole process. So, whether you're a newly diagnosed patient, a seasoned veteran, or a friend or family member supporting someone on their own journey, this episode will hopefully be helpful for you. All right, let's kick things off by talking about your healthcare team. So, this can include doctors, nurses, administrative staff, social workers, and any variety of specialists that you may have to see. So, knowing who's who and what their roles are can really help you feel more confident in your communication. So, your oncologist is the one that's primarily responsible for your actual cancer treatment. And then they have a team of nurses who typically provide the day-to-day care and support. Then, on top of that, you have the office administrative staff that helps with things like scheduling and communicating with your insurance company. And then there's also social workers who can assist with emotional and practical needs. And then additionally, I would say there's nutritionists that can help guide you on any dietary choices or plans during treatment. So definitely don't hesitate to ask for clarification about everyone's role and who they are on the team. It's totally fine to say something like, hey, I'm a bit confused about who I should reach out to for this type of question. Can you help me with that? Or let me know who can. I think this type of communication or question shows that you're engaged and also helps establish a collaborative relationship right from the start. So building a good rapport with your healthcare team is essential, I would say. Don't be afraid to share your preferences, any past experiences that may affect your treatment. For example, if you have allergies or reactions to certain medications, let your team know that type of information right away. If you're someone who, let's say, has a lot of nausea from past treatments, let them know that as well. Try to communicate that type of information up front as much as you can. And then also don't forget about other team members like pharmacists who they can provide insights into medications and side effects, and also physical therapists. They can help with recovery post-surgery or post-treatment. So building that rapport with your entire team can be super beneficial. Okay, so that's your healthcare team. Let's talk a little bit about family involvement with your healthcare team, because you definitely shouldn't be navigating this alone, and I really hope that you're not. Okay, so with regards to family, I think it can be really helpful to share your treatment plan with your family so that they understand who's involved in your care and how they can better support you. You could consider having, a family meeting or a call with your healthcare team present with your family to ensure that everyone's on the same page. I know early days of the diagnosis for me when I was in the hospital, when doctors would come to my room to talk, I would politely ask, is it okay if I call my family and put them on speakerphone? They want to listen in, and then they may have some of their own questions. I was always met with a yes with this, and no one ever had an issue with that. I think this type of cross communication creates a solid support system between your family and your healthcare team, and that enhances your overall care. Another thing I think is that you should definitely encourage family members to ask their own questions during appointments. They might be thinking about things from a different lens. And so this not only provides additional perspectives, but it also reinforces the teamwork aspect of your cancer journey. It's not just you and your healthcare team, it's you and your family and your healthcare team. Thinking back to my own journey, I remember how crucial it was to have my family involved in those discussions with my doctors and nurses. When I was first diagnosed and after my family had gone back to Texas, my husband came to every single appointment with me, and he still tries to do the same. Him being there not only provided the emotional support that I definitely needed during that time, but it also ensured that I had someone to bounce questions off of and clarify any information that I might have missed or misheard. There was this one time I remember when we were discussing treatment options, and my oncologist mentioned a clinical trial that I could possibly be a part of. But I was feeling totally overwhelmed. The idea of a clinical trial initially to me kind of felt like we had, run out of options, and this was like a Hail Mary. And that definitely made me feel overwhelmed, as I often am at appointments. But having my husband there was really helpful. He jumped in and took over, and that opened up a whole new discussion to understand, why this clinical trial is being presented and why she thought that I would be a good candidate for it. And we also talked about the benefits of it and then the risks associated with it. So I think it's really moments like that where having a family member or spouse present really highlights the value of having a strong support system and how important that is. I think another important aspect is trust. So, trust is a huge part of your relationship with your healthcare team. You have to feel comfortable expressing your concerns, asking questions. If something feels off or if a proposed treatment doesn't sit right with you, always trust your gut. It's totally okay to say something like, I'd like to take some time to think about this before moving forward, or I'm not ready to make a decision yet. Remember, your health is the priority and you have to feel confident in your treatment plan. Also, I want to bring up the point that this relationship, it's a two-way street and information shouldn't be just taken in from the doctor to you. You should also feel okay and good about being proactive. So let's say that you read something online about a treatment or you see an ad for a particular medication, definitely bring it up to them. I'd say something like, I came across this article or ad about this new treatment called XYZ. What do you think about it? Do you think it's something that could work for me? I think this shows that you're invested in your care, you're doing your own research, and it encourages a two-way conversation between the doctor and you. Okay, so now that we've talked about your team, let's dive into how to prepare for your actual doctor's appointments. I think it's really helpful to come to appointments ready with questions and concerns that you may have. So before your visit, take some time to jot down notes on what you want to discuss. And for example, you might ask about specific side effects of a treatment, alternative treatments, or what to expect in the coming days and weeks after your appointment. I often tell people to write down at least 3 questions that you want to ask during your appointment. And I think not only does this show your interest in your treatment plan, it also helps to make sure that you don't forget these vital questions in the moment. And if you're feeling nervous about asking questions, consider bringing someone along with you to your appointment. They can help take notes and remind you of what you wanted to ask. They can also ask questions on your behalf. I think it's always best just to communicate ahead of time to your doctor or nurse that you're going to have someone come with you. They may need approval from you to share your medical information in front of that other person, but they can usually get that with just a message on the portal. So definitely consider doing that. Actually, funny story related to taking notes. I remember one time I got in trouble from my oncologist because she had asked me what specific date I had started taking a medication. And I went to my phone to check. And while I was on my phone doing that, she asked me, "Do you need to be on your phone right now?" It was hilarious, but a bit embarrassing. And so now with her, I usually write my questions and notes on a physical piece of paper. And if I do need to check my phone, I'll let her know, let me check my notes on my phone real quick. If your doctor is more old school, you might want to stick to pen and paper so that they feel like you're paying attention. Or maybe that's just like a one-off experience that I personally had. But regardless, just see what feels right. So, what I basically do is that before each appointment, I will create a list of concerns or symptoms that I want to address. This list really helps me to stay focused during our conversation, and it also helps that I don't forget anything important. For instance, if I notice a new symptom, I write it down so I can describe it clearly during the appointment. I usually jot down ahead of time, like what date it happened, what I was doing during that time. I basically just keep a running note in my notes app on my iPhone that says next doctor's appointment, and I put everything in there. And that way, it's all in one place and I can easily find it. And then if I do need to transfer that over to pen and paper, I can do that quickly. Another tip I would say is bring along a notepad or use your phone to jot down notes during the appointment. This way you can capture any important details or instructions given by your doctor. There's always so much information that's happening and being exchanged during this meeting. And so I think if you don't write stuff down, it's very easy to forget. And if something comes up later that you forgot to ask, don't hesitate to call or message your doctor for clarification. I've definitely done that before where I leave an appointment and I get to the car and I remember something. And so I'll just send a quick message saying, I'm so sorry, forgot to ask this today. Can you please ask my doctor, blah, blah, blah. Another thing you could consider doing is making a short agenda for your appointment. You may find it helpful to message your doctor through the portal the day before the appointment. You could say something like, I'm looking forward to our appointment tomorrow. I want to discuss these particular topics. Just wanted to highlight them here now so you have them ahead of time. I've done that before as well, and it was definitely well received and no one had a problem with it. I'm trying to think of other things that have been helpful for me during this time. I think you want to discuss your treatment plan with your doctor in a way that helps you understand your options. So you can use phrases like, can you explain why this treatment is being recommended? Or what are the potential benefits and risks associated with this? I think this not only encourages dialogue, but it also ensures that you are getting all of the full information. Another thing that just popped into my head, I actually like to dress up for my appointments. I think it gives me a little boost of confidence, and then that makes me more willing to ask all the questions I have and engage in, deeper discussions. I think, of course, wear whatever you feel comfortable in, whether that's a nice outfit or sweats, do whatever feels right for you. All right, so we've identified who your healthcare team is, how to prepare for appointments. Let's talk about effective communication techniques that you can use when you're in your appointment. I think first and foremost, it's important to be direct and honest. Don't shy away from expressing your concerns or feelings. For example, if you're feeling anxious about a new treatment plan, definitely let your doctor know that. You could say something like, I'm feeling really anxious about starting this new treatment. Can you help me understand what to expect from it? I think this opens up a dialogue and it allows your doctor or healthcare team to address your fears directly. Also, don't hesitate to ask for clarification if something isn't clear to you. It's totally okay to say, I didn't quite understand what you meant by that. Could you explain it in a different way, perhaps? This not only helps you, but it also ensures that your provider is aware of how effectively they're communicating to you. Like maybe they're not explaining things clearly or in a way that a non-health professional understands. So I think that type of feedback is good to give them. And another useful technique I think you could try is that repeating back information to confirm that you're understanding correctly. So you could say something like, so what I'm hearing is that we're going to proceed with XYZ treatment and I should expect ABC side effects. Is that correct? I think this ensures that you both are on the same page and it clarifies any potential misunderstandings. I also think it's important to maintain a respectful and I think professional manner is the word I would use with your doctor. And when I say respectful and professional, that doesn't mean you can't keep it light and conversational. It just means that there should be a level of respect there. So while I think it's so important to express your needs, your worries, your fears, remember that your healthcare team is there to help you and you're both working towards the same goal. And if you're like frustrated about how you're feeling or side effects you're having, just remember that it's you and your healthcare team together working for you to feel better. It's not you versus them. I think it's so important to show gratitude for their efforts and, just tell them how grateful you are that, they're taking you on as a patient, that you're happy to be working with them. And I think that all around just makes for a positive environment for, both healing and communicating. Um, Also, I would say practice active listening. So make eye contact, nod along as your doctor and nurse is speaking. Try not to be on your phone unless you're actively reading off a question from your notes. I think that not only shows that you're engaged, but also encourages them to communicate openly with you, and it'll make them feel respected that you're valuing their time. I mean, I think none of us like it when we're talking to someone and the other person's like on their phone or looks busy or distracted. So just keep that in mind. I remember this one time when I was extra vulnerable with my doctor, and, I shared with her that I was scared about the side effect of losing my hair on this new treatment I was starting. And, I told her I'm scared because that could possibly happen. And I told her that, losing my hair is one of the biggest worries I have about the side effects of treatment. Like I can push through the nausea and, we can work out a pain management plan, but I'm really worried about my hair falling out. And I think for me, it's, hair is such a big part of my personality. It's a big part of my life. And I'm sure a lot of you can relate. And, I just have this big worry around it. I actually thought she would maybe, think I was being like silly or vain because here we are talking about stage 4 cancer and I'm talking about being worried about losing my hair. But she wasn't at all. She was actually so warm and comforting, and she really appreciated my honesty and was so understanding of my fear. She actually went ahead and put me on minoxidil to help proactively with hair loss, which I'm so grateful for. I think that moment not only, was I able to get on a medication for that hair loss, it also strengthened our relationship and it allowed me to feel more secure in her care that she understood my needs. But again, if I hadn't articulated that to her, she would have never known. So just remember that, your healthcare team is made up of human beings who, care about your cancer treatment and your overall well being. And expressing your fears and concerns fosters this sense of empathy, which can lead to a more tailored treatment approach. And I think when you open up, it creates a connection that encourages them to be more attentive to your needs. And those needs can be, physical or emotional, or in my case, I don't want to say superficial, but like a physical appearance need. There was another time when I voiced my concerns about feeling tired and super fatigued and like how it was impacting my day-to-day life. And again, I thought maybe she would just kind of dismiss it and say, that's part of the treatment side effects is that you're going to feel tired. And actually, she not only listened, but she also helped me figure out some strategies on prioritizing what's important in my day and doing those activities first so that by the time the fatigue really sets in that I have, the more important things done. And she also talked about some exercises I could do. So overall, it was very well received and, she didn't dismiss it in any way. And I think those types of conversations have made me really feel like I'm, a part of the treatment plan rather than just like a passive recipient. It feels like her and I are working together and we're identifying what's important to me and working on that stuff together, and not just her making decisions and I'm just receiving the care. All right, let's switch gears and talk about self-advocacy. So I think this is all about ensuring that your needs and preferences are met during treatment. One powerful way I think to advocate for yourself or stay organized during this process is keeping a really detailed medical journal. In this journal, you can record symptoms, side effects, any changes you experience. And I think all of us, we feel these things in the moment, but then when it comes down to talking to our doctor, our care team, we often forget what's happened maybe 2, 3 weeks ago. And so I think this information can be invaluable during appointments. It really gives, concrete data that you can discuss. So this can be a physical journal, or again, use the notes app on your phone. I think another key aspect of self advocacy is getting second opinions. So if you're feeling uncertain about a recommendation or treatment option, definitely do not hesitate to seek a second opinion. And I think even if you feel good about your option, it's always good to get a second opinion. And I think one way that you can communicate that to your doctor is saying, thank you so much for presenting this. I'd love to get another perspective on this treatment plan before we move forward or before I decide. Most doctors understand this, they respect your desire, and they actually will welcome you to do that. So don't be afraid or feel nervous or awkward if you want to get a second opinion. I think it's so important to have all of your options, all of your doctors that you could possibly get care with, and then make the decision based on that information. So I think on top of keeping a journal of some sort, also remember that most doctors and hospital systems now have patient portals, and those are a great way to communicate with your healthcare team. You can access your medical records there. You can schedule appointments. You can send messages usually directly to your healthcare team. So definitely make yourself familiar with those tools. And I think when you know the online system really well, that can also empower you to take control of your healthcare experience by having access to all the data, all the records. For instance, my online patient portal at UCSF, it's called MyChart. I think MyChart is actually used in a lot of hospital systems now, but it's a really fantastic way to communicate with my healthcare team. All my providers can see all of the messages, so it's a one-stop shop for all of my issues. Recently, just last week actually, I was experiencing a lot of pain. I messaged my oncologist, who added in my pain management doctor into the conversation, and within hours, we had created a new pain medication schedule for me. And then they also scheduled a spine MRI for me this upcoming week. So it was all very quick and efficient. And then just a reminder, don't overuse these portals. Like, it's not a chat, it's not GChat or AIM. And I think although sometimes it can feel that way, use it when you have a problem that needs attention. Also, when you're advocating for yourself, don't be afraid to express your preferences. It doesn't always have to be a need that you're talking about, it can be a preference. So, for instance, if you have a specific concern about a particular side effect, communicate that to them. Saying something like, I'm really worried about nausea from this treatment. Are there ways that we can address this ahead of time? Again, I think it shows that you're engaged and proactive in your care, and they can, like 9 times out of 10, give you something ahead of time before that side effect really presents itself. Also, remember that it's okay to say no. If a treatment or a medicine doesn't feel right for you, tell them. Your comfort and well-being and your quality of life should always be priority. So maybe a treatment's working really well, but you're feeling awful from it. It might not be the right treatment for you. And they can let you know, like, is this your only option, or are there other alternatives that you could try? Another thing I want to highlight is that many oncologists, especially good ones, understand the emotional toll that cancer can take on you. They can actually connect you with mental health professionals who specialize in supporting cancer patients. For me, in my situation, my oncologist referred me to a psychologist in their practice, or in the broader UCSF practice, who focuses on helping patients adjust to their diagnosis, undergoing treatments, and how to manage like the day-to-day living with a stage 4 cancer diagnosis. He's awesome. Him and I talk about self-help skills, things like meditation, and those have significantly improved my overall quality of life. I also joined a weekly support group that he holds virtually, and it just made a world of difference in how I've handled my feelings and mental state throughout this treatment. I still have my bad days, my low days, but I feel like I have tools now on how to make those days a bit better or to shorten the length of time that I'm feeling low. So don't hesitate to ask your oncologist if they know of any similar resources or professionals that they can refer you to within your own practice. As you navigate this crazy journey, remember that your voice matters. Don't wait for someone to ask you how you're feeling or what you need. Take the initiative to express it yourself. For example, if you find yourself feeling fatigued, tired, exhausted, difficulty with certain daily tasks, let your oncology team know. They can help suggest resources or modifications to your treatment that can help alleviate those concerns. Maybe you need a lower dose of a medicine. Maybe you need to get vitamin injections or vitamin supplements. They can help with all of that. I literally just sent a My Chart message recently, and the subject of that was update on how I'm feeling. And I just listed out my current symptoms, my current mental health state, and they responded right away and they said, thank you for letting us know. Do you need some help with scheduling an appointment with the psychologist, or how are you managing your anxiety? And I think overall it was just a really good, quick update, and then them just asking, do I need anything from them, or was I just notifying them? Another thing that I think you could consider doing is joining a support group. Um, I don't know why the word support group sounds kind of awkward to me, or just the concept seems awkward, but since I've, become a part of this cancer world and started, being a part of some of these support groups, they're really honestly great. And I think it's a good way to have a feeling or sense of community and understanding with people who they really get it. And they get it in a different way than your family and friends do. So yeah, I joined a virtual support group that I'd found through social media last year, and it made such a big difference in how I've processed my feelings about treatment and just feeling less alone in this process. And yeah, a lot of times we'll just, story swap and say, I ran into this issue and this is how I dealt with it. And someone else will share their story. And you just hear a lot about how people are managing their own care. And it's just really helpful. All right. So now we've covered communication, advocacy. Let's close out by talking about navigating insurance challenges. By the way, this is by far my least favorite part of the healthcare journey. I think insurance companies are awful. Having to deal with, state or employer disability is terrible. And I'm currently stuck in my own battle with that right now. But let's talk a little bit about insurance challenges before we wrap up. Understanding your insurance coverage is essential to avoid unexpected costs. So do not hesitate to ask your healthcare team for help with this process. It can be very daunting to take this on your own. So definitely work with your administrative staff with your oncologist to understand costs and benefits that are available to you. Okay, so first, make sure you review your insurance policy. So log in to your insurance website. You can pull up your policy. Try to really understand what's covered regarding treatments, medications, copays, deductibles, all of that stuff. If anything is unclear, which I'm sure it will be, reach out to the insurance company for clarification, call them up, or use the online chat system if they have one. Sometimes you may need pre-authorization for certain treatments. This means your insurance company needs to approve the treatment before you can get it or receive it. If you do run into this issue, definitely ask your doctor's office to help with this process. They often have a lot of experience dealing with insurance companies. So let's say that they've determined a treatment is necessary and then your insurance company comes back and they've denied it. You may have to appeal that decision. Your admin team of your oncologist can help you in writing a letter for appeal. They will probably have to provide, certain medical documentation to support the case. So, reach out to them and ask, do they have some sort of template that you can use for doing this appeal? They've probably done this before. Or you can also try Googling insurance appeal template. I'm sure you'll find something there. Another thing that you can do is consider utilizing a patient advocate. These are often available through hospitals or cancer centers. These are people that can help you navigate the insurance landscape, and then they can work to resolve any issues regarding coverage. Um, Honestly, I should take my own advice here and use one of these people because I've just about had it with dealing with my current fiasco. But having someone knowledgeable on your side can make a big difference. And, if they've done it before, they probably have some really good tips and protocols to do. And lastly, in regards to insurance companies, I would say definitely keep detailed notes, records of your communication with them. Jot down like when you talked to them, the time you talked to them, the name of the representative you were speaking to. This documentation is invaluable because if you need to dispute a claim or escalate a matter, you're going to need to have this information. I remember dealing with insurance challenges even before my cancer diagnosis. I remember there was a medication one time that I was trying to get, but it wasn't getting approved. And it was just very overwhelming, frustrating. And I had to reach out to the nurse of that doctor, and she helped me understand the appeal process and guided me on how to articulate my needs. And, it led to the medication getting approved. It definitely took several months to get it done, but this nurse definitely knew what she was doing, and I had no idea. Also, make sure to keep a close eye on mail or emails from your insurance company. Sometimes and often they send you letters about changes in your coverage or policy. They also will give you, a lot of times they don't send you an email, they just send you a paper notification in the mail, which is also part of the current headache I'm dealing with because I missed some letters they mailed to me. And I'm now, past a certain deadline. So I kind of blame my husband for that one. Sorry, honey. I love you. But we need to check our mail in a more timely manner. And probably just need you to open my mail for me at this point. All right. And then lastly, not really related to insurance, but related to just finances. If finances do become a significant burden for you, that's also another area where you can reach out to your healthcare team and talk to them about it. They can often refer you to financial assistance programs or social workers who can help you navigate those challenges and maybe apply for some aid there. There are organizations that provide grants or financial resources specifically for cancer patients who are facing financial hardships. So if that's you, definitely reach out to your admin staff and see if they can help out there and connect you with those people and get that process going. All right, guys, I think that wraps up today's episode on how to communicate and advocate for yourself during cancer treatment. We've covered the importance of understanding your healthcare team, preparing for appointments, effective communication techniques during your actual appointment, self-advocacy strategies, and navigating insurance challenges. Remember, you are your own best advocate, and by speaking up, asking questions, and ensuring your voice is heard, you can take charge of your healthcare journey. It's all about building a relationship with your healthcare team, preparing for your appointments, and not being afraid to express your needs, worries, concerns, preferences. Also, as we talked about, don't forget to leverage the support of resources like local support groups. Also, check out the American Cancer Society website or Cancer Care website. Those are two additional resources that can provide help during your cancer journey. Thank you guys for listening in. And as always, I'm here for you. If you have any questions or topics you'd like me to cover on future episodes, feel free to reach out. You can find me on Instagram at Bisma.